Hello, my name is Dr Kate Lovett. I'm the Dean at the Royal College of Psychiatrists, and I'm sorry that I'm not able to be in person with you today. First of all, I wanted to say a very warm welcome on behalf of the Royal College of Psychiatrists to all of you. I know that you've travelled from all four areas of the UK to be here. The reason that I wanted to put something on video to lend my support to what you're doing today is because this is really important. You're all champions for perinatal and have been motivated to come here to learn more from experts about perinatal psychiatry and service development. The lack of perinatal services throughout the country is, at best, a national scandal, and we know from research and from figures available that standards and commissioning of services varies hugely depending what part of the country you come from. In effect, perinatal mental health care has run a postcode lottery for a long time. So it's with huge pleasure and gratefulness that this is now very firmly on the agenda for NHS England in terms of supporting funding to develop services. But we know that services can't exist without a well-trained workforce. So thank you for putting yourselves forward to do this 3 days training which is being funded by NHS England. I know that there's an exciting programme ahead of you, and feedback from previous courses has demonstrated that it's been received extremely well. Perinatal mental health conditions are extremely common. At least 1 in 10 women develop a mental health condition in the perinatal period. So the Royal College of Psychiatrists are very proud to be associated with this work. We're a charity that exists to improve the lives of people with mental illness. So this work is absolutely core to our charitable aims. As Dean of the Royal College of Psychiatrists, I have two roles. One is as a trustee of the charity, and the other is to manage the educational portfolio of the college, all the way from supporting school students who are interested in careers in psychiatry through undergraduate training, foundation training, core and specialist training, right through to the end of careers and supporting our colleagues develop their true professional potential throughout their careers. So we can't deliver any mental health care without a workforce. The perinatal mental health workforce needs to increase by over 400% in order to achieve the aims of the 5-year forward view. But we've got a problem. 80% of our core training posts are filled, leaving 20% of posts unfilled. Our recruitment rates for specialty training remain at an all-time low. So we have lots of work to do together at improving recruitment to psychiatry training in the first place, and also to retaining our trainees. We lose about 35% of our trainees between core and higher training. So I'd encourage everybody over the next 3 days to think carefully about our contribution to recruitment and retention, because without a workforce we're not going to be able to achieve our aims. I think we need to make every contact count, whether that be contact with work experience students, with medical students, nurturing and supporting our foundation doctors, core trainees. And I'd encourage everybody to go away from these 3 days as an ambassador not only for perinatal psychiatry but for psychiatry as a whole. So enjoy the next few days, form networks and keep in touch.